I'm Hayden Bush, Senior Online Editor for Hospitals and Health Networks magazine, and welcome to the preview of our February issue. First up, we'll be hearing from Senior Editor Matthew Weinstock, who'll be taking a look at this month's cover story, iGovernance.
So the cover story this month is about iGovernance, which is a really hot topic these days, given the gravity of information technology is playing now in healthcare. Between meaningful use, ICD-10, those are big issues, but there's also this incredible push for IT to be part of health reform, from pay for performance and value-based purchasing and bundled payments. There's a real requirement to get more data out of your IT systems. So hospitals are finding that they really need to set and structure a better way to manage those IT projects. And not just health IT, but also all their capital outlays for IT. Health information technology, MRI machines, upgrading all that equipment. It's really a massive undertaking for hospitals these days. If you look at just one hospital we profiled, Baylor Health System had 430 projects on tap for fiscal 2013. So they got to figure out a way to manage all those projects. And what we're finding now is that iGovernance or IT governance is what's taking place, rather than what used to happen was sort of a haphazard decision-making process. So now they've got committees and structures in place to really manage the whole process. And the other thing to point out is that this issue comes out right when we'll be going to the HIMSS conference, which is in Las Vegas this year, and we'll be reporting live from there for H&HN Daily. So look for those live reports from HIMSS later this month.
Next up, we'll be hearing from H&HN Managing Editor Bill Santamore, who'll be taking a look at this month's clinical management piece on observation units.
So the clinical management piece in February is about observation units, which relatively few hospitals have adopted, but they have several benefits. These units are for emergency department patients that don't need to be admitted, but they do need additional testing or diagnostics or observation management for psychosocial needs. Among the benefits are that they enhance throughput in the ED, so they eliminate overcrowding, they eliminate the need for ambulance diversion, they make patients happier because they reduce the long waits that are typical of emergency departments, and so that increases patient satisfaction for hospitals. They also are good alternatives to short stay admissions, which are getting more kind of wary looks from RAC auditors these days, which isn't to say that there aren't some drawbacks, some things that you have to watch out for if you're going to establish an observation unit, and we cover those in the article.
And finally this month, I wrote about the evolution of palliative care, which is moving from a service only offered to terminally ill patients to something that every patient who enters an ED or an ICU receives analysis for. I talked to doctors and nurses charged with implementing these programs at a broad cross-section of U.S. hospitals, and while every program is unique, each doctor and nurse I talked to stressed the importance of communicating with patients and their families as an essential element of palliative care services. This has been Hayden Bush for H&HN Daily. Thanks for watching today.